Hello everyone, it's Helen here with Helen with Helen. Thanks for joining me. Today we are going to talk about interstitial cystitis. Say that 3 times, it's quite a tongue twister. However, this big fancy word means nothing more than bladder inflammation and bladder irritation. But this painful condition can often mimic a UTI, a urinary tract infection. In fact, I went to the doctor 3 times because of my symptoms, only to find out that I did not have a UTI. I had interstitial cystitis. The first couple of times he put me on rounds of antibiotics, and by time 3 he said, we do not have a UTI. I think I know exactly what we're dealing with because I've seen this before. All right, so is there testing available? There is testing available, and that is a good thing. This way the doctors can see exactly what's going on with you, and they can definitely treat you for what you are dealing with. I have heard that it is a little bit painful and it's a little bit uncomfortable. However, I do believe it will be worth it. I had just recently had a hysterectomy, though, prior to discovering that I had interstitial cystitis. So he was able to rule out a lot of different things. One, I didn't have a uterus, I didn't have ovaries, and I just had a major surgery. So therefore, he already knew, like, okay, she doesn't have endometriosis, she doesn't have cysts, she doesn't have cancer on the uterus. Whereas if you have not had a full hysterectomy, these are things that your doctor is going to want to be looking for. And it could even be GI related. A lot of times people who have GI issues are going to be dealing with pain and discomfort in this area as well. Some of the symptoms that you're going to be looking for, and this is just some and not limited to, because I know that there's many, but probably a lot of pain here in this pelvic area. You can be dealing with bloating. You're going to have a feeling of fullness, like you may urinate, but then you're going to feel like you still have a full bladder. You're also going to have stinging and irritation after using the restroom a lot of the time. In fact, you may go and then 2 seconds later, you'll have to go again because it feels so uncomfortable and you have a stinging sensation. Again, those are some of the symptoms that you would deal with if you had a UTI. So you're just extremely uncomfortable when you have interstitial cystitis. Okay, the one thing that I did learn about interstitial cystitis is there is no cure for it. However, there is treatment available and it is not deadly. So that should make all of us feel comfortable. It's just something that you will have to learn to deal with, and you'll have to make the adjustments to make yourself more comfortable. Well, some of the things that are obviously uncomfortable, one would be intercourse. We already know, because anytime that any pressure is in here, if you're dealing with this, is going to cause you pain and discomfort. The one thing that I have discovered that really probably will help you is you need to definitely use the restroom after you have had any form of intercourse. You're going to want to go to the bathroom, probably going to want to go again, and you're going to want to go again. You're going to want to flush anything out that would be causing you irritation, and drinking a full glass of water. And these are all things that are similar to if you had a UTI. And so another thing is diet. I always talk about diet, but it's so important because I have noticed that diet is huge. It's a huge factor. In fact, the treatment that they have right now is some different medications. But for me, if you're anything like me, I wanted to try everything possible before going on a medication, because we also know that sometimes they can cause side effects. So I'm just like, I'm going to try whatever I can. So I started keeping a journal of the different foods that I was eating and when I would feel like I was having a flare up, because the flare up, it's like I may go good for a couple of days and then all of a sudden I would have like the pain, the discomfort. I'd be in the restroom more than usual. And so I'm like, okay, what is causing it? So I started keeping a journal of some of the different things, and it was usually dietary stuff. And so I noticed that anything that was really sweet, like cookies, cakes, cupcakes, ice cream, all of those things would cause me pain and discomfort in this area, and would also cause me pain while urinating. Same with spicy foods. There were certain spicy foods that I was eating where it was like, obviously it was going to cause inflammation in the bladder. I'm somebody who deals with acid reflux, so you're going to have pain up here, but not only was I having pain here, I was having pain here. And again, I was having to use the restroom over and over and over again over a series of hours. And then another thing for me would be anything acidic. And so you're probably thinking like, okay, well then what can I eat? Well, you will have to discover what your body agrees with and what it doesn't agree with, because everybody is completely different in this way. Like I just told you, for me, a lot of the times it was the sweet stuff, spicy stuff, some acidic stuff, and of course, greasy foods. Like, and I can usually do like maybe a little bit of a greasy steak or something. That doesn't seem to bother me. But whereas like maybe chicken strips or French fries or anything that's battered and deep fat fried will give me a ton of pain down here. So just by getting rid of those few little things or not eating them on a regular basis has helped me immensely. I have a couple of friends who are dealing with interstitial cystitis as well, and some of them had to have the testing. Some of them even went on the medication that is available for you just to kind of help with the symptoms, but they are now off of it, and they have been able to be comfortable and live healthy just by changing their diet as well. And so anytime that they see that they're having a flare-up, they start juicing. Like they'll take different things, whether it be cucumbers, apples, whatever may work for you, and then they juice it, they compress it, they do it for a week or 2 weeks until they start to feel better again, until that inflammation goes away, and then they get back to normal. So the key here is just balance, it's moderation, and it's knowing what your triggers are and trying to stay away from them as much as possible. I'm not going to say I don't eat an occasional ice cream or something spicy or whatever, but I also know how I'm going to feel that day after eating it, and you're probably not going to want to eat it and then eat it and eat it again, because you probably aren't going to be feeling very good if that's the case. And so just by controlling your diet has been huge for me. I had my hysterectomy in 2012. And so over the last 10 years, I've been able to do that just by diet alone, and I have not had to get on medication for it. So hopefully that helps you. And then last but not least, stress. We already know that stress impacts every single thing in your body, right? Every single thing. Of course, stress goes right to the stomach. That's the number one place where stress goes. So you're going to have inflammation. You're going to get a flare up. If you are stressing out about something, and I've seen it time and time again with myself, with my friends who struggle with it, anytime that they're going through something really, really stressful, they have a flare up. And so that is one thing that you're definitely going to want to work on as well, if possible. I know there's a lot of stressful things out there, but if you can do anything, whether it be exercising, meditating, whatever makes you feel good to get rid of some of that stress, that will be very beneficial for you. So hopefully some of these tips helped you. If you are struggling with this, or maybe you have been to the many doctors and they can't figure out what's going on with you, and some of this kind of resonates with you, maybe look into it, talk to your doctor, and see if you can't get some testing done. Thank you. Have a good day.